Hello, my name is Bernie Dawson. I'm the strategic lead for community integration and transformation for children and young people at Hull Health and Care Partnership. I'm part of the NHS and part of the Humber and North Yorkshire Integrated Care Board, or ICB. And I want to present to you today a short presentation about a project that we are leading with our partners. And this is about meeting the medical, health and care needs of children and young people in Hull in education. And this presentation is aimed at parents and carers. So just to let you know what our session will include. So welcome to all of you parents and carers who are watching this video, and I'd like to say thank you for your time. And this is one of the first opportunities for you to get involved in the work, and there will be other opportunities as I take you through the presentation for you to get involved going forward. This session will last about 10 to 15 minutes of your time. You can pause, stop, rewind, rewatch as many times as you like for this presentation as well. So I want to talk to you about the project, which is called a review, and I want to talk to you about the who, the why, the how, the what and the when. And the parental survey at the end, I'll give you a link and a QR code that you can hold your mobile phone up to with your camera, and it takes you straight forward to that survey. And that will give you another opportunity to get further involved, but also to raise any comments or questions that you might have following watching this presentation. The presentation is based on the stakeholder statement that you may or may not have seen. It is available via your school and your representative from the Parent Carer Forum, and it's an easy read version. So we want to put some context into the presentation as well. Oops. All right. So who? So as I've mentioned, we're the Hull Health and Care Partnership. We're part of the NHS. And we're working with our partners in the local authority and with schools, with parents and carers, and with representatives from our health providers to understand what the health and care needs of children in Hull are that attend our Hull schools. We know that there's lots of people working together already to support and get the right support in place for children and young people when they're in school, and that involves your school staff, it involves health staff from a range of different health services, and involves partners from our local authority children's services and social care. So why are we doing this work? We know that, as I've already mentioned, there are already a range of people working with your child, and we've got a statutory responsibility to work together to make sure that children and young people with medical conditions and health and/or care needs, their needs are met within their school so that they can go to school, they can learn, they can have fun, they can make sure that they participate in the school and the school day and reach the potential. So how are we taking this work forward? We've got a steering group that Hull Health and Care Partnership are leading alongside our senior partners from our local authority, Hull City Council, from parents and carers who are represented by the Hull Parent Carer Forum and by parent governors at the schools, which I'm going to mention in one moment, and by some of our healthcare providers. We are supported in this work by the Council of Disabled Children, and they're providing us with some expertise and some independence into this review. As part of the review, we want to ask parents and carers, children and young people, school, health and care and social care staff, what they think. You know, how well are children being supported currently within the schools? What could be better? What's maybe not working so well, and how could we make some improvements? Which schools are we talking about? We're talking about the first three schools, which are Frederick Holmes, Twin Dykes and Ganton School. And these are the schools that we've chosen to look at first. These are the schools in Hull that support some of our children with the most complex medical conditions and health and care needs. And we know that over time, the health and care needs and health conditions of children in school have changed over time. We see children with more complex needs, such as ventilation and gastric feeds and other needs, going to school in mainstream schools and participating fully in the school day. We also know that the demand for needs around children with neurodiversity conditions and neurodiversity issues is increasing as well. So we need to make sure that the health and care services that we offer actually meet the needs of our changing children's population needs. So what do we need to know? We need to know what current training school staff have to care for children and people with some of those needs, and how we can make sure that the children who are going to school, we keep them safe and all their health needs are met. We want to understand who provides healthcare for your child or young person when they're at school. Is it a health professional, such as the children's community nurse? Is it a therapist? Is it a specialist nurse for long-term conditions? Or is it a TA or a healthcare assistant or a member of the school team? There are lots of people that are supporting children to make sure their health needs are met. So what are we doing? I've already mentioned the steering group, but we're also having some meetings in Hull with parents and carers. So we've got some drop-in sessions, and we've got some online sessions where they are live and parents and carers and staff can ask us questions during that session. And we're looking to work with school staff, social care and healthcare workers as well. And this is to make sure that we understand the changes in some of our schools, and that we can all work together and that we listen to each other and understand the views and experiences of all of our stakeholders. And that's what we mean when we call it a review. So when is this work taking place? The steering group started meeting last year in 2023. So it started in the autumn when we collected, and we've been collecting some data in each of those 3 schools that give us some information about the current medical conditions and health and care needs of the children attending those schools. And also by understanding and gaining the views and experiences of parents and carers, children and young people in those schools, and the staff who work in and who go into school to support those children and people, what those views and experiences have. And just to reiterate that nothing will change whilst the review is happening. So the current provision in health care services into schools won't change during this review. So just to reiterate some key messages from the presentation. This is a joint partnership review. It's led by Hull Health and Care Partnership as part of the NHS, and part of our NHS responsibilities are to provide healthcare services into school to support children with medical conditions and health and care needs. We want to take this with a stakeholder perspective, so working with our local authority, children's services, healthcare providers, parents and carers, children, young people, and other staff who work to support children in school. And we want to co-produce this work going forward. The 3 schools that we've chosen first are Frederick Holmes, Twin Dykes and Ganton Special Schools. We want the review to be informed by data or information from key sources. So that includes, we know that all of our children have education, health and care plans in those 3 schools. So what is some of that information telling us about the main health needs and how we meet those? We're talking to schools themselves, and we also are extending our consultation to include stakeholders by parents and carers and children and people, and what their thoughts are of what's working well and what could be improved. We've got a comprehensive communication and engagement plan, and this video is part of that communication plan, and it's the start of communicating with our wider stakeholders as well. The review will make some recommendations, and there will be consultation, such as now, around those proposed recommendations. And I want to reassure parents and carers that there is no change to the current delivery of health and care services and support to pupils in those 3 schools during this review. Any recommendations that are made as a result of the review would not take place without stakeholders and would be subject to consultation with those stakeholders as well. The staff and parental surveys are open for all staff who work to support children, either in school or going to school to support children, and that includes education staff, school staff, healthcare staff, social care staff, and our children's SEND team, so anybody who works with children in those 3 schools. And it's of course open to parents who have children attending either of those 3 schools as well. There are 2 short surveys that should take no longer than 10 minutes to complete, and the surveys will give you an opportunity to ask any further questions, raise any issues, and tell us what your views and experiences are, what's working well and what could be improved. The survey also gives you an opportunity as a parent and carer, and if you're working as a staff member in school or going into school, to get involved going forward. And there will be different ways that we take this forward as well. So there's an opportunity to leave your name and your contact details so that we can collect a wider group of stakeholders as we take this work forward. And here is the QR code. So if you've got a mobile phone and you want to point your camera at that QR code, it will take you straight to the parental survey. And I've been working on this presentation with my colleagues from Hull Health and Care Partnership and from Humber and North Yorkshire Integrated Care Board. So that's myself at the top, Bernie Dawson. Tara Harness is our designated clinical officer for SEND, and she represents Hull and North Links Health and Care Partnerships. Amanda Axe is our deputy designated clinical officer for SEND, who's part of the Hull Health and Care Partnership and the Humber and North Yorkshire Integrated Care Board. And last but not least, we've had the expertise of Frankie Jackson, our engagement manager, who supported this work as well. So thank you for your time, thank you for listening, and please do get in touch, complete the survey, send us your details, and we can make sure that you are involved going forward. Thank you for your time. Goodbye.